my daughter, Kendra. She wrote in her own words how she found out she had leukemia. So I'm going to read you her story. On September 18th, I went in for a routine physical examination with my primary care physician. At that appointment, my blood was drawn as part of a usual exam. The very next day, I received a call from my physician while I was at work stating that I needed to report to the hospital in Seattle immediately and met with an oncologist. To my surprise, I was diagnosed with B-cell acute lymphoblastic leukemia, and I would need to be admitted to the hospital for the next 30 days to undergo chemotherapy. Upon arrival to the hospital, they performed many tests, which included additional blood tests, bone marrow biopsy, brain MRI, EKG, and an ultrasound of my heart. A central access line was placed in my chest the very next day to allow them to administer the chemotherapy. After the bone marrow biopsy results returned, it was discovered that I had the MLL gene regiment. This is complied with my white cell count of 115,000, and the normal range is between 4,500 to 10,000. It put me at a high risk category, which resulted in the necessity of a stem cell transplant. I was 29 years old, a mother, a wife, a student, a soccer coach, and the sole provider for my family. Not only was I scared about the diagnosis, but how our family would sustain financially, as I needed to be admitted for at least 10 to 15 days each month for the next 8 months to a year. The recovery and healing process, both mentally and physically, just from the cancer itself, takes a lot of time, not to mention the effect that it has had on my husband and my 2 young children. The bills are very overwhelming and add an exuberant amount of stress to our family.